Who is more likely to have a sudden stroke, myocardial infarction, or cerebral infarction? Conditions such as sudden stroke, myocardial infarction and cerebral infarction often occur without warning and have a devastating impact on individuals and their families. Understanding these conditions requires a deep understanding of their risk factors, mechanisms and impacts. A stroke is a medical emergency that occurs when the blood supply to a part of the brain is interrupted, resulting in a lack of oxygen and nutrients to the brain tissue. Within minutes, brain cells begin to die, so it is vital to seek medical help immediately. Strokes are broadly divided into two categories. 1. Ischemic stroke. This is the most common type of stroke, accounting for about 87% of all strokes. An ischemic stroke occurs when a blood clot blocks blood flow to a part of the brain. The underlying cause is usually atherosclerosis, a disease characterized by the accumulation of fatty deposits, plaques, in the arteries. When blood flow is interrupted, brain tissue begins to suffer ischemic damage, leading to the death of neurons and other cells. Thrombotic stroke, caused by a blood clot that forms directly in an artery that supplies blood to the brain. It usually occurs in an artery that has been damaged by atherosclerosis. Embolic stroke, caused by a blood clot or debris that forms elsewhere in the body, usually the heart, and travels to the brain. A common cause of embolic stroke is atrial fibrillation, an irregular heart rhythm that increases the risk of blood clots. 2. Hemorrhagic stroke. A hemorrhagic stroke occurs when a blood vessel in the brain ruptures, causing bleeding in or around brain tissue. This type of stroke is less common but is usually more severe and has a higher mortality rate. The most important risk factor for hemorrhagic stroke is uncontrolled high blood pressure, which weakens the walls of blood vessels. Other factors include brain aneurysms, arteriovenous malformations, and head trauma. High blood pressure is the leading cause of stroke. It damages blood vessels, making them more susceptible to clots and ruptures. The risk can be significantly reduced by lifestyle changes and medications to treat high blood pressure. People with diabetes are at higher risk of stroke due to the damaging effects of high blood sugar on blood vessels. Diabetes accelerates atherosclerosis and causes blood clots to form. Atrial fibrillation is an irregular and usually rapid heart rhythm that can cause blood clots to form in the heart, increasing the risk of stroke. These clots can travel to the brain and cause an embolic stroke. Being overweight and having a sedentary lifestyle can lead to high blood pressure, diabetes, and high cholesterol, all of which are risk factors for stroke. High levels of low-density lipoprotein, LDL, cholesterol can lead to atherosclerosis, increasing the risk of stroke. Myocardial infarction, commonly called a heart attack, is a serious cardiovascular event that occurs when blood flow to a part of the heart muscle is blocked. The blockage is usually caused by a blood clot, which damages the heart muscle. The longer the heart muscle is deprived of oxygen, the greater the damage. Causes of myocardial infarction. A buildup of fatty deposits, plaque, in the coronary arteries is the most common cause of a heart attack. When the plaque breaks open, it can trigger a blood clot to form, which blocks the artery. Coronary artery spasm. A sudden, temporary tightening of the muscles in the artery wall that can restrict blood flow to the heart muscle. This can be caused by stress or exposure to cold. Blockage in the coronary arteries causes a decrease in blood flow, ischemia, and a lack of oxygen, hypoxia, to the heart muscle. If blood flow is not quickly restored, the affected heart tissue begins to die, causing irreversible damage, infarction. Typical symptoms of a heart attack include chest pain or discomfort that may feel like pressure, squeezing, or fullness. The pain may radiate to the jaw, neck, arms, or back. Other symptoms include shortness of breath, nausea, vomiting, sweating, and a sense of impending doom. In some cases, especially in the elderly and people with diabetes, symptoms may be atypical, such as fatigue, dizziness, or indigestion. A cerebral infarction is an ischemic stroke that occurs when a blockage in a cerebral artery restricts blood flow to a specific part of the brain, causing tissue death. This type of stroke shares many risk factors with other cardiovascular events, but has specific features related to cerebral circulation. The most common cause of a cerebral infarction is a blockage of a cerebral artery by a blood clot or atherosclerotic plaque. When the blood supply is interrupted, brain cells quickly die from lack of oxygen and nutrients. The resulting damage can affect a variety of functions, depending on the location of the infarction, such as movement, speech, or cognition. Risk factors for cerebral infarction. Atrial fibrillation, an important predisposing factor, as embolic strokes can occur when blood clots form in the heart and travel to the brain. Carotid artery disease. Atherosclerosis can cause narrowing of the carotid arteries, increasing the risk of a cerebral infarction. Diabetes and high blood pressure. These diseases can cause damage and narrowing of the cerebral arteries.